Hello and welcome, viewers. This is the episode 2 of series Menorrhagia, where we discuss one medicine for menorrhagia in details and compare it with the other related remedies. So now let us get started with it. Medicine for today is thlaspi bursa, which is a very good medicine for hemorrhages. But an additional point that I would like to tell you today is that it's a very good anti-hemorrhagic and anti-uric acid remedy also. Yes, guys, this is a very important point to remember that it's a very good remedy for hemorrhagic diathesis and uric acid diathesis as well. So there is profuse hemorrhage in thalassy bursa, huge profuse hemorrhages, and there is a character of the blood is clotted blood, dark clotted blood. Along with that, there is a violent pain, violent colic and cramps in abdomen. There is uterine colic during menstruation, which is very violent in character. And the uterine colics are so violent that the pain even extend to the toes. So they start in the abdomen, that is a uterine colic, but the pain eventually extend to the toes. This is a very characteristic colic along with the cramps. This is of thalassy bursa. Okay, it's seen after abortion, after labor, after miscarriages, and there is albuminuria during pregnancy. Okay, and it's a very good remedy for uterine cancer also. See the character of menses, it is too early, too profuse, protracted. 10, 8, 10 and even 15 days. In the beginning, in the first stage, it is very tardy. First day merely a show and second day there is colic, vomiting and there is expulsion of large clots. Each alternate period more profuse. This is a character of blood of menses and this is a character of hemorrhage of thalassy bursa. And you have the image of the plant as well. So medicine is prepared for the tincture of the whole plant with flowers, that is in flowering season. Tincture of the fresh plant with flowers. This is a source of the medicine. Now let us compare these with the other remedies, which is very important because in materia medica, the most important thing that we have to do is comparison. So let us get started with it. So these are few medicines which I had discussed in the previous episode also, that is episode 1, which is Aletrix farinosa. If you have not watched that episode, please go and watch that first. In the description you will get the link of that episode. Okay, Crocus sativus. Dysmenorrhea is black, stringy and clotted. So whatever is marked or written in bold, please focus on those, that is the character is black, stringy and clotted. The next you have is platina. Menorrhagia, flow in dark clots and fluids. Fluid is like black tarry or in grumous mass. Next you have meadorrhinum. Menses profuse, very dark, clotted, stains difficult to wash out. This is a character of the blood of meadorrhinum, that it is so dark. If it stains the cloth, it is very difficult to clean it, too difficult to remove that. So this was discussed, but one additional point that I have included today of meadorrhinum is the colic of meadorrhinum, the characteristic colic of meadorrhinum, because colic is there in this medicine also. So there is intense menstrual colic with drawing up of knees and terrible bearing down labor-like pains. If you have visited the gynae and ops session that in the medical colleges, if you have visited that OPD and the labor room, you will see when there is labor, the patient pushes the feet against the floor or against that bed to get the support. So that same gesture is seen here also in this menstrual colic. In case of our medicine today, that is thalassy bursa, the colic is such that it begins in the uterus and the pain extends up to the toes. But here you see the patient is pressing her feet against the ground to get the support. So that is what she does. So that labor-like pain is characteristically seen in menorrhagium as well. Then we have McCarve. See, the character of menses of Menorrhagium and McCarve is very, very similar. In both, you have that same line, difficult to wash the stain, difficult to wash off. But the characteristic difference of McCarve is that you see these words, accurate, dark, pitch-like, these are not written in Menorrhagium, and this character of this blood, pitch-like, like Alcatra. This character is seen in McCarve only. Next is lac caninum. In lac caninum, we have stringy menorrhagia, a stringy blood of menses. I was going to say stringy leukorrhea. So stringy leukorrhea is not there in lac caninum. Stringy leukorrhea is observed in hydrostis and cali bi. So these are the medicine. Calibicromium and hydrostis where you have stringy leukorrhea. But in lac caninum you have that stringy menses. Stringy menses we have also seen in crocus also. But see the color of the blood. In crocus the color of the blood is black and clotted. Here you see the color of the blood is fresh. I mean it's red. Okay, flow in gushes in bright red color and visit. So clots are not there in lac caninum, and the color of the blood is bright red in lac caninum, which is different from crocus. So here we have to differentiate it. The next two medicines are hamamelis, argentum nitricum, which are very important. Let us study for hamamelis first. In hamamelis also dark flow is there and there is intense soreness in the abdomen. So the soreness of hamamelis is very, very characteristic. Otherwise, in hamamelis also there is profuse hemorrhage. Uterine hemorrhage, active or passive, from jolting while riding over rough boots, bearing down pain in the back. And also if you get an injury like after blow on ovary or a fall, okay, the suffering all aggravate at the menstrual period. So this is how you see in hamamelis. Also there is one more medicine, that is Trillium pendulum, which is also there, that menses after exertion. That symptom is also there in Trillium pendulum like hamamelis. But we will discuss Trillium pendulum in full details in episode 3. That will be the main medicine for episode 3 so far which I have planned. So I'm not discussing it today, because there in the next episode we will discuss Trillium pendulum in full detail, because it is also a very, very important medicine for menorrhagia. Now let us come to argentum nitricum. Metrorrhagia in young widows in sterility with nervous erethism at change of life, which is very similar to lachesis. This climacteric change of life, it is also there in lachesis as well. Okay. But this characteristic metrorrhagia in young widows in sterility, that is from nervous erethism, it is seen in argentum nitricum. So we have to investigate the mental history also. Sabina, menses partly fluid, partly clotted. Okay, in the character of blood in Sabina is menses is partly fluid and partly clotted. Okay, before we move to Veratrum album, as you can see in the slide, there is one medicine which is not written here, that is Apocyinum cannabinum, Indian hemp. In the character of menses in Indian hemp is also, it can be clotted or it can be fluid, right? So if you go through Indian hemp, you can apply that in amenorrhea also. It's a very good medicine for amenorrhea also. It's a very good medicine for this menorrhagia also. So anything, but the characteristic should be there. You see, palpitation is very important in Apocyinum cannabinum. Palpitation, that pulse, if you see the pulse of Apocyinum cannabinum, it's very quick. The patient is very weak, very debilitated. Okay, these are things which along with that you have to see the character of the menses, that is, it can be fluid also, it can be clotted also, it can be anything. Okay, paroxysmal flow will be there in Apocyinum cannabinum. So Indian hemp and along with that vomiting and all may be there, but it is not mentioned here also here in the slide, so I am mentioning it separately because you cannot miss on that. Apocynon cannabinum, if savanna is written, then you have to compare it with Apocynon cannabinum as well. To see the character of veratrum album, dysmenorrhea with vomiting and purging, an exhaustive disorder, okay, exhaustive dysmenorrhea with cold sweat. So that is the characteristic. Cold sweat is a very characteristic feature of veratrum album. Along with vomiting and purging, it will be very severe. See, vomiting, purging will be very severe. Okay, like in ammon carb also, like in bovista also, vomiting and purging, this will be very severe. But along with that dysmenorrhea and along with that characteristic cold sweat, which is very important feature of veratrum album. Coming to ammon mule, a medicine which you cannot miss. During menses, there is diarrhea and vomiting. This is a typical line which is written in ammon mule during menses. Yes, so let's call it a day. And if you really like my videos, then please do share it with your friends, share it on your wall, and please subscribe to my channel. Please inspire me to do more and more videos. Thank you so much.